Good morning. Well, it's not really morning unless you're watching this in the morning, but Cody and I are in Fort Lauderdale because we are going to see Dr. Christiana Marone. She's a doctor of physical therapy, and she's a Graston provider, so she does like the scraping on your muscles. And so we'll introduce her, and she's gonna do a little work on us, so we'll have a, you guys can check that out. All right, so we are here at the zoo with Dr. Christiana. How are you feeling?
We're just starting.
We're just starting.
Calf sucks.
The calf sucks.
We're gonna change up Cody's ankle mechanics because Cody is very flat foot, especially when he's weight bearing. So that means when he's squatting or he's doing any type of activity where he's loaded on his foot, he's putting a lot of pressure in that posterior tibialis tendon, and that runs all the way up in here, and then he'll feel that tenderness right in that medial gastroc head right in here. And you can see how red he's getting already just from a little bit of that grass, and he's tight and tender right in here. And you can follow it all the way up. So he complains of that inside knee pain that comes all the way in here too. So he's placing a lot of stress on that inner part of his knee. So we're gonna change up a lot of body mechanics for him. So just strumming in between that gastroc head and where the posterior tibialis lies. And you can follow that all the way down.
How's that feel, Code?
Like amazing.
Amazing.
Oh.
Have you gotten any body work done or no?
No.
So even right where his Achilles tendon lays, right, he's got a lot of tenderness in here. So what we're gonna do is we're gonna take this
All her tools.
my Dexter tools. So we're gonna push his tendon to the side, and we're really just gonna scrape right off of it. You okay?
No comment.
No answer.
Are you okay?
Are you okay? So it's important. There's a bursa that lays underneath here too, where your Achilles tendon inserts into that heel. Again, really important to change up the mechanics of his feet. So Cody is going to this week go and get inserts for his shoes and start lifting, not flat foot without his sneakers on, at least the orthotics.
Oh my god.
Yeah, let's send it in here. A lot of the times too, you know, Cody came in complaining of knee pain, back pain, shoulders aren't working right, so we're addressing everything. I like to look at things from the top down and bottom up. Sometimes just changing that little bit on an athlete can really make a difference, you know?
It already looks like looser.
A functional release to this knot he's got going on. Look, now he's got some definition here. Go ahead, pull. There you go. And then back out. There you go. And now you can see almost the two heads, so I just want to separate this just a little bit here. It what? It's amazing what just a little bit of that, you know, TLC to your body does. All right, push that foot towards me. So make a calf muscle. There you go.
Yeah, you can definitely.
Now make a calf muscle on this one. So not tenderness, but get it right in here. So he's putting a lot of pressure in that medial head here. Okay, relax. All right, let's see this one.
Oh.
Wow.
So this a little bit more tighter than this one.
Oh yeah.
Tenderness right into this posterior tib that goes all the way up into that calf muscle. And has more tension in here than the outer side. I mean, that's a lot of people, but because he's so flat foot here, he's putting a lot more stress on that side. And then it's almost, a lot of the times, what came first, the chicken or the egg? Is it because he's flat foot that's causing all the mechanics to go poorly, being an athlete over so many years? Or is it, you know, from the top, you know, the top down?
Right.
His clavicle and his shoulder and his mid-back probably being too stiff. Is that affecting his way down? So we work through it all. Try and get everything out and start addressing areas that are weak, areas that are limited for him. You can tell he is very externally rotated too. I will do a little tough on his mobility in a little bit. But it's hard for him to get in this position. This head's gonna hurt. Alright, good, and breathe. And what I'm gonna do when I flip him on his front is we're gonna do a little bit of mobility stuff for his ankles because he's got no dorsiflexion. He goes right about to neutral, so dorsiflexion is the motion of your toes lifting up. And if you're limited in dorsiflexion, a lot of times it affects the squat. Squat, lunging, anything leg press wise.
Got some thick legs.
Yeah.
To get down into the muscle.
I think these are like the biggest ones I've seen. And he's probably like, no.
Yeah.
Make a muscle with that calf. Yeah. Okay. Pull this up. And resist me pulling in. Okay, foot like this. Now try and do it. You see how now you fire this? And that's just from putting your foot into dorsiflexion?
Yeah.
So that's why it's huge for you to get those inserts and start working on the mobility ankles. I'm going to show you that. Because once you do that, look, relax your foot how you normally are. Okay, now just pull. Go ahead, pull me. So he doesn't fire the medial head too much or the hamstring. Okay, relax. Now he dorsiflex his foot and go ahead, pull me. Right away you'll see this whole thing pop out more.
Yeah.
So again, really changing up just little tiny things. Alright, let's start scraping these. The other thing is, you guys doing any IT band work?
No.
Okay. So if the IT band is really tight and tender on the side of that leg, okay, it almost can get stuck to this outside head of the hamstrings, and that can also limit the amount that you're able to fire this muscle as well. Same goes for the outer quad, but if you're so quad dominant, I doubt that's your, you know, your biggest issue. But so I'm gonna have him fire. So go ahead, like this. Good, fire in. Good, relax. So we're just waking stuff up for him. Let me see, I want to just check something on his mobility. So, now we're talking about external, internal rotators of the hips. Okay, I'm going to have him relax his legs out. So not too much external rotation. That tells me how tight his internal rotators of his hips are. Okay? Now if I have him come out a little bit wider with his hips, which he doesn't want, but he's gonna do anyway. I'm gonna relax him and try and drop it down. Don't let the legs hit. So he's got plenty of that, right? It's uncomfortable though. You can see him like lifting that hip up. He doesn't want to go that way. So definitely a lot of work on those rotators too. But you have good internal rotation. You're like the complete opposite.
Yeah, I'm the total opposite.
And you can even check too with like piriformis. A lot of times people's piriformises are tight. He's got good.
Right.
His internal rotation is just limited.
Oh yeah, you can tell his body does not want to do that.
His hip just like hikes up.
Yeah.
He doesn't want it. So we're gonna just go in and separate each of his hamstring muscles, separating the outer one from the IT band. And I'm just going in and doing this little quick motion so you can get in that fascia that lies. Everyone talks about fascia, right? It's like a spider web matrix that lays in between the muscles. And that can be a lot of times a problem for a lot of people. It's just that stiffness.
Right.
Bodybuilders especially. But the cool thing is you can really separate, so go ahead. Try and do a hamstring curl for me. Good, so then I can see that other head, good, relax. And I can just start separating in here. Now everyone's is different. You okay? Okay. It's important that you're not going over this area. You got a lot of blood vessels and nerves that run through very close to the surface. So I go real light, I'll go on the outer part where the hamstrings go, here, and then the hamstrings also come down on the outer part and insert on that fibular head right here. So that's where that IT band meets everything. All right, let's do this fire now. Gonna bring this up. Good, toes towards me, and fire. What do you feel different? Okay. Okay. This one pops too a little bit. All right, relax. So it's important that you work on the mobility stuff a little bit too. So for him, very limited here. I'm gonna just do a little bit of a mob here. Try and relax that here. So I'm just pushing on the actual femoral head and distracting it away from his hip capsule.
Can you feel anything? His butt is so big.
I know, right? Now, we get right onto the sacrum. I'm just going to kind of push and pull. So it is important for him especially to start working on the mobility of his hips. And I'll show him a quick little exercise I like to do before legs, before deadlifts. And it'll help him actually kind of focus on that mind muscle connection for his hamstrings as well. So we're going to work on opening up his paraspinals. He's got a lot of trouble getting a mind muscle connection to his lats, having them grow a little bit. So we're going to work a lot of mobility in his shoulder joint and really opening this lat that's kind of bound down and tight on him. So Cody hasn't gotten any type of soft tissue work since he started bodybuilding as well as an athlete. So I'm excited to kind of see what happens for you. He gets red right away.
Right away, yeah.
So I'm even doing a really light stroke, trying to just warm up his tissue area. You can tell how much those paraspinals fire on him. Yeah, I'm really not even pushing that hard. And you can see his whole paraspinals just light up a little bit. So let's go into his lats. And let's see how Down we are here. So you can see his lats, he's got good lats. It comes all the way down in here. So it's really just working on kind of opening them up a little bit, getting that mind muscle there. Start teaching him how to open this up a little bit. A little bit to his lat insertion. His lats come all the way here and then insert around here, and then you got teres that comes through and wraps by his deltoid too. So what I have him in is he has his paraspinals on a stretch, so his extensors are being flexed, and I got his lat in a stretch too, so I have him all the way open like this to kind of open him up a little bit. Doing that with the stretch really helps open that up too. That kind of breakaway right off the spine. Coming in towards me. My fingers just chat. You ticklish?
Tickles?
Is it more my finger that's tracing your spine that's ticklish?
No.
The tool? Okay.
You weirdo.
So this might be more ticklish for him. We're gonna go in between each vertebrae.
Oh, cool.
Okay. So you got a lot of ligaments that lie in there. You have interspinous ligaments. Not that I can necessarily get to them, but again, I'm gonna get to that fascia around it. So I'm gonna just block off. And I'm gonna block off each segment and kind of help open him up a little bit. So do a little bit of transverse. And he can feel me right in between that vertebrae. So going at a 45-degree angle. Really taking care of that. I know that's ticklish. He's doing his best though. And then you can count your whole way up. A little bit more meteor up here. So I can really get in between these two. And I'm working on thoracic mobility with you guys. Is gonna be big too, kind of helping open up that chest. Okay, but you can see like how he gets so red right afterwards.
Oh yeah. Oh, you can see like his whole spine.
Right. Yep. So as beefy as he is, you can really get in there. How are your knees holding up, okay? Okay. All right, let's bring his arms to the left. And these. There you go. So we're gonna open him up on the left now. Okay. What I want you to do, you have no mobility in the shoulder. So here, shit, I'm touching your eyelash. Okay, here, I want you to turn this arm all the way down, thumb down, and come up like this. Okay? Relax it down a little bit. Go ahead. Open. Good, and then back in. Okay. Again. Back in. Alright, keep it down like this. I'll tell you what, since I started really doing more of my manual stuff, my grip with some things has been much easier.
Oh.
Yeah, this is down and tight, my dude. So a lot of times, a lot of people find limitations around their scapula, at least what I find. And that tends to be more of a limiting factor in people's lifts than actually having a shoulder issue, like an impingement or a rotator cuff issue. When you have good mobility of this spine, your mid-back, your thoracic spine, and you have good mobility or strength in your mid and lower trap compared to so much dominance in your upper trap, then a lot of times the actual shoulder joint works beautifully. So he's more limited right in here than his left. Yeah, he really blew up here.
Wow.
Yeah, I like stenciled him.
You can see his
I really didn't go that hard on you.
What does it look like?
You'll see. It looks like your spine.
So we're getting a little bit more on those lats. Working our way right into them. You feel that? Right into the arms, right where the lat inserts, the shoulder. Really crunchy right here. Because what I'm going to do is I'm going to work my way into subscap, which is a major internal rotator of the shoulder. And that's not going to feel too good.
Oh.
I gotta get his face.
See, this is the most bound down I felt on you.
You can hear it. Unless that's like, is that the skin or the muscle?
That is the fascia.
Feels like you're rubbing your finger over like sand.
Sandpaper, yeah.
It's so bumpy.
He is so bound down between his shoulder blade and his mid-back. So a lot of things I'm going to have him work on to improve his chest and his lat development and getting mobility back in the spine, especially decreasing the pain in the front part of his shoulder from how limited it is. He is so upper trap dominant. His lower trap's not firing, his mid trap's not firing. So we're going to try and really, I'm going to gently kind of rock him because he doesn't even want to lift off.
Yeah.
And got it a little bit. So you're really just pulling the shoulder blade off from the thoracic spine or the rib cage in the back.
Oh, wow.
You gave him goosebumps.
I got some over there. Sometimes. No, he really doesn't want to move. But a little bit with my fingers. at how bowed down you are up there. That looks a little bit better.